filler procedure on a man here who's just very, very early signs of facial atrophy or some loss of some of the facial structure. Primarily right here underneath the eyes, there's a little bit of a hollow forming, a little bit of a shadow. It's very common. On the other eye as well, here we have a little bit of hyperpigmentation as well, a little bit of darkness, and that increases the look of the shadow. Gives sort of the illusion that there's a shadow in this area. So we can use some lightening cream to lighten up that pigmentation, or use a laser procedure to lighten that pigmentation, and then also fill the shadow so that you'll get a smoother look to the side of the eye. It's a subtle effect, but it's really a very powerful one. A little earlier I did do some Botox injections in this area to eliminate some of the smile lines. Go ahead and smile for us. So we get quite a bit of smile lines here. So that will soften this. Go ahead and relax. And then we'll also fill this area. I'm giving the needle a little bit of a bend. That allows me to stay in a parallel plane underneath the skin. So there'll be a little poke. The skin's been numbed, but you'll feel a little bit of a poke here, Andre. You okay? Mm-hmm. Good. There's also lidocaine in the product, so once we start doing the injection, then the lidocaine will keep them numb. So what I'm making sure is that I'm injecting under the rim of the muscle into a little potential space here. And you can see the shadows start to lift immediately. Might be a little hard to see on the video, but as you can see, it's a very simple procedure. Let me just sort of smooth things out. And there's a little bit of smoothness in this area now. How did that feel?
Didn't feel anything.
Good. Numbing creams are great. They really help. And then again with the Botox, when that does kick in, which it has not yet, it takes about a week to get the effect from the Botox. Then that will keep this area smooth and prevent some of that crinkling around the eyes so that the product will stay nice and smooth. So this just sort of, the two will work together. One will replace the lost volume. That's the filler. I'm using Restylane right now. It's a natural hyaluronic acid. It's what the body makes that binds fluid underneath the skin and gives a nice smooth plump look. So it is really quite natural. It's not permanent. It's only going to last about maybe 9 months. A little bit less in this area that's more active, and a little bit longer under the eye where there's less muscle contraction. So this area right here already looks really smooth, not as much of the shadows being cast, just looks a lot more youthful, less tired. Over here you still have the shadows that are being formed by sort of the little bit of loss of tissue and a little bit of a depression of the fat pad that normally exists under the eye. It slides down a bit. Those two things sort of expose this rim, the orbital rim, and cast that shadow. So it just looks a lot more youthful when that's a little plumped and smoothed out. And again, when that Botox starts working, and then you won't get the crow's feet lines, and then this area will look really smooth and open, and the whole eye area will look opened up. So that's filler treatment to treat the shadows around the eyes.